started our business a handful of years ago and are very excited to be impacting the lives of clients and families in our area. We do support clients in the suburbs of Boston, mostly north and west of the city. We're in our fourth year and very excited about tracking hospitalizations, and are particularly fond of the mobile app for our caregivers and the ability for our team to capture the care notes electronically and provide them real time to families wanting updates on how mom or dad are progressing. I've seen firsthand how individuals can age in place, but maintaining and managing your health at home is a key piece for staying out of the hospital or rehab facility. Last year during the pandemic, we did see some of our clients that had, like a low triage level go on pause. And they suspended services with us and moved in with a family member, or a family member moved in with them, just to balance the risk of, getting exposed to the virus and so forth. But those family caregivers, they're providing a lot of support even these days, but they don't have the formal training that our professional caregivers do. Well, our care team at Assisting Hands does a lot to keep individuals healthy. Many of these things can be and are being done by family members, though. Our trademarked Thriving at Home approach is aimed to help those family caregivers with the tools and techniques to help keep their loved ones healthy at home. I wrote that book really to help those family caregivers do those non-medical interventions. Folks don't have to be nurses to know what to do at home. So I wanted to write the book to share the knowledge that our team does on a daily basis, but share that with family caregivers. As much as our team might be with a client for 8 or 12 hours a day, after they leave, if something happens, maybe a client trips or falls in the evening, or something doesn't get escalated appropriately overnight, that client could end up in the hospital. And that's really what we're trying to prevent. So the book is really intended to promote awareness and options for getting support at home. We were tracking and noting client hospitalizations at the client level. Again, it was just in our notes. There was no log in terms of where we could report on this data. Everything was a little bit ad hoc in our system. It was noted, but it was ad hoc. There was no way to report on it. Our team had a hard time finding it as far as where that information was. Was it in certain client notes, in a profile, or where it might be? So we enabled it immediately, system-wide, and started tracking immediately. We also now ensure that new clients are assessed for the hospitalization risk when we start on with them, and get their previous hospitalization information upon starting up a new client. Our triage levels now take into account, the level of risk for hospitalization, but we had to gather, when they were last in the hospital, when they went into the hospital, if we had that data, and the reason for going into the hospital. That data is critical for tracking your readmission rates. The tool is very helpful in that it highlights information gaps, alerting our office team to any information that's missing, particularly that initial prior hospitalization data. Gathering previous hospitalization information during new client assessments, to creating individualized care plans for our clients. Also tracking all incidents and falls, which are the leading indicator for hospitalizations. Also being able to report our readmission rates now at that aggregate level as an agency. We were able to use the standardized way to calculate our rates, as well as the standard reporting out of AxisCare, to monitor very quickly, easily now across all of our clients, in different ways, how we want to sort them as well through the client classes that we're using, whether they might have a certain chronic condition or others. We can kind of compare rates across different classes of clients even as well now. As their focus, our office team is focused on quality of care. They immediately embraced the tool when we rolled it out. As we want the best for all of our clients, it is just a tiny amount of extra effort for a major benefit to our clients and families and even our partners. Falls are the #1 leading indicator. Tracking all incidents, though, even if they don't result in a hospital admission, is critical. Care escalations are another area that we're looking into. When caregivers call the office or escalate to our care advocates or just seek additional support. These are areas that we're still investigating and improving in our tracking and insights on risk level. Well, we regularly monitor our readmission rates and are now tracking in the very low single digits. But as far as the results of the Thriving at Home approach, how it really shows up, and that focus on keeping clients out of the hospital is really in our client satisfaction. Our client satisfaction data is now very strong, and we're winning awards in the Boston area as a provider of choice. Our caregivers are also happy. They're getting their supplemental training, but also they have more consistent schedules with their clients remaining at home and not going into the hospital as much. We're also receiving referrals from new partners who see our focus on hospitalizations and driving high client satisfaction and caregiver satisfaction as true differentiators in the area. In home care, we're in the business of preventing hospitalizations. I would start by tracking all incidents and hospitalizations immediately. Although the data is after the fact and you'll understand how you're doing or how your results have been to date. But what you can also do today is you can start to take proactive measures that can impact your rates as well, ahead of gathering all the statistics and data to report out on your rates. Update your intake process to capture hospitalizations, specifically tailor your care plans to address potential causes. And lastly, train your caregivers on what to look for and to flag causes for hospitalizations prior to a crisis event happening. I appreciate the opportunity today and hope my experience helps agencies out there, but also helps keep clients healthy at home and out of the hospital. To find more about our Thriving at Home approach, you can visit our website at assistinghands.com/BostonNW. To find information about the book, Thriving at Home, a handbook for preventing hospital stays, you can find it on Amazon or on our website, thrivingathomehealth.com.